What the heck are, well, screw that. Should cancel that. Darn it! Oh, this is embarrassing. You're an embarrassment. Dentist on a couch, party time, yeah. What the heck is a dental bridge? This is not the card game that my grandmother kicked everyone's butt in. This is not what allows us to cross large bodies of water. This is a way to replace a missing tooth. So exciting. You got a tooth pulled out of your head. You think that's the end of the problem. It doesn't hurt anymore. What could go wrong? Plenty of things. Plenty of things. We have teeth for a reason, believe it or not. When you take teeth out, you lose valuable chewing surface. I don't want to lose valuable chewing surface. Good. Now you're chewing with less teeth. That puts more pressure on the remaining teeth. You're more likely to crack and chip teeth. Patients often lose their back teeth first. They start chewing more on their front teeth. Then the front teeth start getting chipped, worn down, fracturing. It's not pretty. First rule of Tooth Club: take care of your teeth so you don't lose them. I have videos on my channel to teach you how to do that. You don't even always need a dentist like me to take care of your teeth. You can just do it yourself at home in a lot of cases. Sometimes you need a dentist, but it's less than you think. Second rule of Tooth Club: when you lose a tooth, you need to replace that tooth. One time I was at an open mic doing stand-up. It was close to Halloween. There was a pumpkin sitting in the windowsill next to the speakers and microphone. While I was doing my little skits on stage, a man walked past the windowsill outside the bar. He took the pumpkin off the windowsill and he placed a new pumpkin on that windowsill. Then he said the words, "Take a pumpkin, leave a pumpkin." And he disappeared into the night. You should bring that same attitude to your teeth. If you take a tooth out, you need to put a tooth back in, lest ye end up looking like a jack-o'-lantern. One way to put a tooth back in is a dental bridge. A bridge means you put crowns on the teeth on either side of where the missing tooth is, and you suspend a fake tooth in the middle of those teeth. It's all attached, right? It's one connected unit. The fake tooth rests on your gums in the space where the missing tooth was. A bridge is permanently cemented into your head. You don't take it out. It's not like a partial denture or a denture. It feels like a normal tooth. The positives of a bridge: you got your tooth back, right? You have more chewing surface. You don't have a smile that's all wacka-cock-a-doodle-doo. You got a normal head again. Negatives of a bridge: if there isn't anything wrong with the teeth on the sides of the missing tooth space, then you have to cut down perfectly healthy teeth. That kind of stinks, right? If the teeth next to the tooth where you had the tooth pulled are healthy, I always recommend a dental implant. Yes, it's more expensive, but it's nicer because you're not damaging any other teeth to get your tooth back. That's why I chose for one of my front two teeth to be replaced with a dental implant, because there was nothing wrong with the teeth on either side. I didn't want to have to cut down these teeth. Also, if you place a dental implant and something goes wrong at some point, you have a one-tooth problem. If you place a dental bridge and something goes wrong at some point, you have a three-tooth problem. You know, one tooth is less than three teeth in terms of problems. You diggity? Also, it's harder to clean around and under a dental bridge. You have to use floss threaders. It's a sort of plastic sewing needle to move floss under the bridge to clean it and make sure you don't get cavities on the teeth that make up the bridge. A water flosser can also come in handy for cleaning around a bridge or an implant. So, most of the time, if you get a tooth pulled, I'd recommend an implant. If you're going to have an implant, then you need to have a bone graft placed at the time of the tooth removal. A lot of people don't realize that. Bone grafts help with implant placement. Despite all the advantages of dental implants and the downsides of bridges by comparison, I still have plenty of patients who opt for bridges. A bridge is still better than not having a tooth. A bridge is also less expensive than an implant, and it can be the better option for some patients for that reason. What's the procedure like? How do you get a dental bridge? Well, After you have a tooth removed, you should wait at least a couple of months before you make a bridge. When you remove a tooth, the gums and the bone tissue change a lot. If you make the bridge too early, you'll have a gap underneath it between it and the gum tissue, and it will pack and trap food, and you're more likely to get decay that ruins the bridge. So, wait a couple of months, then you'll have an appointment where your dentist will put a temporary bridge in place after reshaping your teeth. They'll take a digital scan or impression of your teeth and send that to a lab for them to make your bridge. Some dental offices can also actually mill out your dental bridge the same day that they take your digital impression. So you could get the bridge the same day that you have the teeth reshaped. It depends on the office. Either way, you still have to wait for healing after the extraction though. Also, if you're wondering what you do with a missing tooth for those 2 months, there are ways to put a temporary tooth in place. There are several options on how to do that. You can talk to your dentist about the pros and cons of each of those. Bridges can be used to replace multiple missing teeth. At the risk of confusing all of you, our general rule of thumb as dentists is that we have to have greater than or equal to the root surface in the bone on the supporting teeth as there is missing root surface from teeth that were removed. Hopefully that makes sense. Basically, 2 teeth could support a bridge that was 4 teeth in length. 3 teeth could support a bridge that is 6 teeth in length. You can push the limits a little bit depending on where you are in the mouth and what level of risk you're willing to tolerate as a patient, but with dental implants these days, that's usually the better way to go. Just get the dental implant. We didn't always have dental implants to save the day when patients lost teeth in the past, so dentists used to get a little more creative with bridges sometimes. Once you have a bridge in place, it does feel quite natural. Other than the change in the cleaning routine with floss threaders and a water flosser, you're not going to notice that this is any different than your natural teeth. The other option for replacing teeth is a removable partial denture. This is a thingy that snaps in around your other teeth. I'll make another separate video about those. They're not great. I don't really recommend them. I still make them for patients. They're less expensive, but they're kind of a nuisance. Like most patients don't like them. If you lose your eye, a dental implant or a dental bridge is like getting a new eye. It's really impressive. People can't tell it's not your eye. You can even see with the thing, right? You can chew just like normal. Getting a removable partial denture is like slapping an eye patch on there. You know, it's not the same. Arrgh. It's not the same. The goal of these videos and the dental health tips playlist on my channel is to set you up for success in a dental office. I know very well the common inefficiencies and costly pitfalls patients run into in dental offices. I want to help you avoid those. I want to set you up to be an ideal dental patient who knows how to find the ideal dental provider for you so that you can have an ideal dental experience. Now, I use the word ideal loosely because things in life go sideways in a hurry all the time, but I want to help decrease the likelihood that that happens to you. I'm a huge proponent of preventative medicine. You know, most dental problems can be avoided with simple, healthy habits at home. I want to help you build those simple habits to help reduce stress in the dental chair and help you avoid financial strain from healthcare expenses. I have a dental health tips playlist on my channel and linked in the video description. That playlist is full of longer, more in-depth videos to give you guidance on how to avoid dental problems and keep a happier, healthier, more functional smile. By the way, I do stand-up comedy and I enjoy photography. Huh? What? Yeah, yup. Please subscribe to my channel if you want to know more about that. I'll be making videos involving dentistry, comedy, photography, basically anything I enjoy that I also think you will enjoy and find informative. I'm on Instagram at Comedic Exposure. You can check out my website if you want to find future info on comedy shows and albums I plan to produce. That's anotherlazymillennial.com. I'm also on TikTok at Mike the Dentist. Please like, share, subscribe to my brand. I'm not a person anymore, I'm just a brand. Please smell, taste, and feel my brand. It's a good brand. Thank you.